Good evening. I'd like to call the Tuesday, October 13th City Commission for the City of Pittsburgh meeting to order. Please join me in the flag salute. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right. Continuing on the agenda is public input. Is there anyone coming forward for public input? All right. Seeing none, we'll move on to our proclamations. We have a couple tonight, which is really great. The first one is to recognize World Polio Day. And is Mr. Anderson here? Okay. You want to join me on the white square there? Say a few words if you'd like to. Whereas Rotary, excuse me, I need to get my glasses. Sorry. I only got as far as Rotary.
Biggest word.
That's right. I got proclamation. It's really big. All right. Whereas Rotary is a global network of neighbors, friends, leaders, and problem solvers who unite and take action to create lasting change in communities across the globe. And whereas in 1985, Rotary launched Polio Plus, and in 1988 helped establish the Global Polio Eradication Initiative, which today includes the World Health Organization, the U.S. Centers for Disease Control and Prevention, UNICEF, and the Bill and Melinda Gates Foundation, and Gavi, and the Vaccine Alliance to immunize children of the world against polio. Polio cases have dropped by 99.9% since 1988, and the world stands on the threshold of eradicating the disease. And whereas to date, Rotary has contributed more than $2.1 billion and countless volunteer hours to protecting more than 2.5 billion children in 122 countries. Getting foggy. Rotary is working to raise an additional $50 million per year, which would be leveraged for maximum impact by an additional $100 million annually from the Bill and Melinda Gates Foundation. And whereas these efforts are providing much needed operational support, medical staff, laboratory equipment, and educational materials for health workers and parents. And whereas there are over 1.2 million Rotary members in more than 35,000 clubs throughout the world that sponsor service projects to address such critical issues as poverty, disease, hunger, illiteracy, and the environment in their local communities and abroad. Now, therefore, I, Don McNay, Mayor of the City of Pittsburgh, Kansas, do hereby proclaim October 24th, 2020 as World Polio Day and encourage all citizens to join me and Rotary International in the fight for a polio-free world. Would you like to say a few words?
Oh, just a couple. Thank you very much on behalf of Rotary for the support from the city. We're getting really close to eradicating polio overall, but this has been an international fight for quite some time, and we've made great progress on it, but we really appreciate everyone's support.
Great, thank you. All right, I'd like to invite Kyle Rogers up, and if there's anyone else from the Nazarene Church.
Hello.
All right. From the Office of Mayor, proclamation. Whereas the history of the Pittsburgh Nazarene Church dates back to July 17, 1920, when a tent revival was held on the corner of 4th and Tucker, and whereas the Pittsburgh Nazarene Church was officially organized 6 weeks following the first tent revival, and after 346 professions of faith were accomplished, and whereas 19 pastors have stood at the pulpit of the church since 1920, each bringing with them a variety of backgrounds, abilities, and goals for the members of the congregation. And whereas since 2014, Kyle Rogers has led the Pittsburgh Nazarene Church, and whereas the Pittsburgh Nazarene Church has expanded to include churches in Girard and Columbus, Kansas, and whereas for the past 100 years, the mission of the Pittsburgh Nazarene Church has been maintained by its devoted and dedicated congregation. Now, therefore, I, Don McNay, Mayor of the City of Pittsburgh, Kansas, do hereby proclaim today, October 13th, as Pitt Naz Day in Pittsburgh, and congratulate the church on 100 years of service to the community, and wish the congregation continued success for years to come.
Thank you.
Yeah.
Thank you. This is a great honor, and we want to just, our church would like to say thank you. There is obviously a lot of great churches in town, and we are honored to be one of those. And we just want to partner with the community and letting people know that God's love is real. So thank you so much.
All right, thank you. Moving on to the consent agenda. Are there any items to be removed from the consent agenda?
Item F.
I'm sorry?
F.
F.
Okay. Let's talk about it.
Which item?
F.
K.
K.
You got a K on there?
No.
No, that's under regular business.
Yeah,
so-
it's in a regular.
Okay,
Yeah,
all
that's
right.
K, no.
we good? Okay. The items to be considered under consent agenda. Approval of the September 22nd, 2020 City Commission meeting minutes. Approval of staff recommendation to award the bid for the City of Pittsburgh Facilities Sanitation Service to Shorts Trash Service of Frontenac, Kansas, based on their low bid in the amount of $905 per month for the contract beginning January 1st, 2021, ending December 31st, 2022. Item C, approval of staff recommendation to award the bid as needed sanitation dumpster service to Shorts Trash Service of Frontenac, Kansas, based on low bid in the amount of $115 plus $46 per ton per pole for a 30 to 40 yard dumpster for the contract period beginning January 1st, 2021 and ending December 31st, 2022. Item D, approval of staff recommendation to grant easements to Evergy Kansas South, Inc. for the relocation of electric lines along 4th Street and for the installation of new electric lines to serve a new substation along 520th Avenue, with Evergy compensating the city in the total amount of $9,900. Item E, approval of staff recommendation to accept a grant in the amount of $100,000 from the Kansas Housing Resource Corporation to administer the tenant-based rental assistance program to provide security deposits for low-income households. We're skipping F. And G, approval of the appropriation ordinance for the period ending October 13th, 2020, subject to the release of HUD expenditures when funds are received. Heard a motion to approve the consent agenda items.
So move.
Second.
Moved by Patrick, seconded by Larry. Roll call vote.
Brooks?
Yes.
Fields?
Yes.
McKnight?
Yes.
Munsell?
Yes.
O'Brien?
Yes.
Motion carries. Item F, approval of staff recommendation to approve a real estate sale contract, affidavit of understanding, an indemnity and hold harmless agreement due to the coronavirus pandemic, and indemnity and undertaking agreement in relation to the City of Pittsburgh's purchase of the property located at 525 South Broadway from the Community National Bank in the amount of $92,000. Okay, do you have a specific question, Chuck?
No, I don't have any questions. I just wanted to pull this off, because I'm not in favor of staff recommendation. I won't vote to approve it tonight. And I thought as a reason that I need to give to the taxpayers. I don't feel taxpayers should bear the cost because the property owners neglecting to keep their property in shape according to our ordinance. We should enforce our ordinance the same way every time. In my opinion, anyway, I feel we should enforce our ordinance the same way every time for everyone. And when we don't do that, we send a message to property owners, if we buy their property because it's in disrepair, that there's no need for them to worry about maintaining it because the taxpayers are going to pay for the demolition if that happens. So once again, I just wanted to let people know that I am not in favor of taxpayers bearing the cost of property that property owners fail to maintain according to ordinance. Thanks.
And Commissioner, certainly respect that opinion. I don't know if it makes any difference or not, but I think everybody should also understand that the person that owned this for so many years and maybe let it get in that condition, the bank took over that property recently, so the city is purchasing the property from the bank, and so I don't know if that makes any difference in
Not a bit.
anyone's mind, but
The bank owns it now, and they're the owners of it, so
okay.
that's my feelings.
All right, any other questions regarding this? Is there a motion to approve?
So move.
Second.
Moved by Patrick, seconded by Larry. All those in favor say aye.
Aye.
Opposed, same sign.
Aye.
Motion carries 3-2. All right, moving on to special presentations. IMA Inc. Health Insurance Update. Christy Powell, Vice President of IMA Inc. will provide an update on the health insurance plan utilized by the employees of the city of Pittsburgh. Welcome.
Hi, good evening. How are you guys?
We're good, thank
Good,
you.
I'll just open this up so it'll be on your recording. If I can use a Mac, I haven't done that since 5th grade, I don't think. There we go, did I do it? Okay, great. Well, thank you guys. I know you have a full agenda tonight, so I won't spend a lot of time, but this is our second or third time having this meeting with you guys. And I've done a similar format in this handout, and so I just wanted to go through some updates for you guys on how your plan is performing since we started working with you guys in 2017, and also some information on how you're performing year to date. And then I can answer any specific questions you guys have about COVID or anything else related to your plan that you guys would like to know. So let's just dig in here really quickly. So on slide 2, you'll see just some key metrics that I've reported for you guys, and this is similar to what I've done last year. At the top, you'll see the gross medical and RX claims, and we break them out into a equivalent called a per employee per month, or the PEPM. So that's what the PEPM stands for. So we've been tracking your claims from 2017. We break them out by medical and RX, which is your prescription drugs. And you can see that really your costs have been relatively flat year over year. We had a slight uptick in 2019. Year to date, they're running still relatively flat and consistent with how your claims have been running historically. In the middle section are just some key metrics as well. The biggest thing I want to call out to you guys is that 9.10%, the negative 9.10%. Your claims are down on a per employee per month basis year over year by that 9%, which is really, really great. So I wanted to call that out. And then in the lower section of the graph is the per paycheck cost. So the other thing that is really impactful and really impressive is that you guys have been able to hold your rates flat still since 2016. So no cost increase to the employees, and the county or the city's cost has been relatively flat as well. So also really impressive. The bottom section of that is just kind of how that per member per month cost kind of gets blended together. So you can see that the medical is still a good portion of the claim cost, and then the pharmacy is there in the orange. And then what I want to call out to you guys is this graph here on the right, the benchmark. So that is actually our IMA book of business. So on average, our clients are averaging $755 in medical claims and $162 in pharmacy claims. So you can see how much lower you are than a benchmark plan that we have in our book of business. And I'm just comparing you to our self-funded clients as well, not our fully insured clients. Next slide is just a quick little graph. You know, had you stayed with Blue Cross Blue Shield back in 2016, I just drew an orange line at your cost structure at that time. And I put a very fair trend factor of 5%, which as we know is probably not where you would have came in at, but just to be fair, I threw that on there. And then I put the blue line of actually how you guys are performing. And so it's about $700,000 delta there if we're assuming a 5% year over year increase. So again, really good performance over time. The other thing at the bottom section of this page that I think is super important and oftentimes gets lost on conversations is just how your plan stacks up to from a benchmark perspective to other plans. And so that's what this graph is representing. So basically what you can see here, and there's two things happening here. One is what the actuarial value is of your plan. So that means what the plan is actually going to pay when somebody needs to get services. So your plan is actually 81% higher actuarial value than what we're seeing on average, is more like 75%. So your plan pays more if somebody gets sick. And then the other thing that's great, and that's what these colors come in, is the blue dot is how much your employees actually pay. So your employees pay about 16% of the cost of their plan. And you can see that orange dot is actually our benchmark. So most plans are charging their employees about 30%. So not only is your benefit richer, you're also charging less, which is really great. I don't get to have these reports very often, so this is awkward to keep having this great news. I mentioned giving you some year-to-date numbers. These are just some graphs on how your plan's performing year-to-date. Right now, your plan is running at 76% of expected, so again, running really well this year. You're probably wondering how COVID maybe impacted your plan, and honestly, for you guys, we didn't see a huge dip down in claims. We saw a pretty consistent month in, month out of claims experience. We did see some other clients that had huge drop-offs in March, and then really that pent-up demand kind of came back into that May and April-May timeframe. You guys have just been pretty steady throughout the plan year. The bottom of this page is just showing you the split of the claims. Again, your RX claims have always been a little higher than we wanted them to be, but your medical claims are substantially lower. So we can't have everything. The pharmacy is the place where we have been making impact with some cost containment triggers that we've been pulling. We'll have a full report at the end of this year on what those changes impacted for your plan, and I can come back and give you that at that time. Next slide. There's a lot going on here. The only thing I wanted to call out here, and this top graph is a lot of the data performance that we sit down with the City of Pitt team on, but the bottom half is straight from our data analytics reporting system that measures about 4 billion different employee data sets. And so what this is telling us is basically how you compare to benchmark. So at the very bottom, you can see medical and RX. You can see the reporting period, the prior period. The 871.39 is your actually the custom benchmark, what we think cost should cost for a group of your size, and you're actually 40% lower. So you're running 40% better than what we would expect you to run than a typical group of your size and your demographics. And so the reason why that is, a good reason why that is been on the next slide, if you'll recall, and we've talked about this briefly, is the contractual agreements that the City of Pittsburgh has with the hospitals. So we have direct contracts in place with Via Christi and with Freeman, and that's done in a couple different ways. The top section is the provider discount. So that's the network that we're renting called Providers Care. And you probably can't see that on the screen, but on your paper handout, you can see that the discounts for the in-network are around 63%. That's equal to or as good as what the big fully insured carriers are providing in the market. So the Blue Crosses, the Aetnas, the United Healthcares. The bottom half of this page is where we get into what we call reference-based pricing. But really what you guys are doing is direct contracting. So we're working with vendors, we're getting direct contracts in place, and we're using Medicare as a baseline to set our pricing. Instead of paying a discount off of inflated allowed charges, we're using Medicare as that baseline. And so you can see here in that square, our overall Medicare percentage is about 155%. And when you factor in your actual plan performance, we're running at about a 70% discount. So we're beating that rentable discount by about, 7% there. We're beating the fully insured carriers by about 20%. So we're really impacting claims greatly by utilizing these levers, and that's something that you guys embarked on prior to IMA partnering with you guys, but it's been a really good fit and it's working really well. Next slide, I think it's my last slide, is just some demographics if you're interested in just your average age. Also interesting is the cost of the plan by the age demographic as well. So this is just kind of a leave behind on your current demographics. I went through that really fast. Is there any questions I can answer for you guys on the plan or the current environment with COVID or anything of that nature?
Do you see Pittsburgh as doing better than other cities that you represent?
Yes, so that benchmark that I mentioned includes all of the cities and counties that we work with, and you would be put into that kind of total benchmark group. So you're definitely drastically better than my public entity book of business that I represent.
Definitely.
Yes.
Are you finding it more difficult, the same, or easier to negotiate directly with the vendors?
So I think it's probably becoming a little more prevalent. So more people are open to it, more facilities are open to it. I think the balance is the right facilities and the right outcomes. We don't want to just direct contract for the sake of direct contracting if it's not going to be a good outcome and someone's going to have another surgery. So it's a fine balance between quality and cost that we have to measure for you guys. But I would say that in rural areas like Pittsburg and different pockets of the state, facilities are open to it and they're interested in it. In metropolitan areas like Wichita and Kansas City, not so much. So you're in an area where you kind of can leverage the rural geography of your location to help you with that. That's a good question. Any other questions?
Well, we need to acknowledge your effort. It's not by accident. Blue Cross was with us for 50 years, and we literally got to the point that we just couldn't afford it without tax increases or cutting services. So we reached out to several companies, and for the last at least 4 years.
4 years, yep.
We've been with IMA, and they come in at the beginning of the year, help us set the plan, so we have an idea based on what we did the year before, what we should do this year without cutting services to the employees, because obviously that's not what we want to do, and we've been very fortunate, I think, that we've actually increased the number and types of services to the employees while maintaining the same cost level. And you have to mention the two hospitals, the direct negotiating that we've done, we were able to do with Via Christi, was tough because they're obviously a hospital that runs in the red, just traditionally as how they do business, but they understand that the people that are paying all of these costs for the city are the same people that live in this community. So they were, after 2 or 3 meetings, we finally got to a place where they could understand where we were coming from and that we were in a tough spot, and they helped us through it, and it's been 4 years now, and I think they'd say that it's been a good relationship, and I know for the taxpayers it's been a very good relationship, and I don't think it's been at the expense of the employees. So
Yeah, if you think about the
Thank
cost
you.
basis of Medicare doesn't really go up that much year over year versus the inflationary landscape of hospitals and how they set their charge masters every year. So you're kind of attacking the medical trend inflation in multiple areas, which is really interesting. I mean, this is certainly, in my mind, a very good case study of how this can work effectively for cities and counties in Kansas and even school districts. It just takes some vision and people willing to get a little uncomfortable with maybe leaving a brand on their ID card and kind of changing the trajectory and the look and feel of their benefits plan. So I commend your staff and everyone. It does take active management. It's not a set it and forget it kind of thing. So your staff does put time and attention to that, which is always what's needed when these things are needed to be successful.
Yes, and that's a good point. I do think, we need to give a shout out to our staff if this is something that is constant, you have to be on it.
Yep, I mean, it's not a set it at the beginning of the year and come back to it at the end of the year. There's always emails and nuances that's just part of the business when we're dealing with an unbundled self-funded health plan. But your team does a great job, and they're always so gracious, and they're great to the people that work for the city. So great culture that you guys have here.
it would seem to me like this lack of increase in our employees' contributions, the health care that we are providing, has to be a real incentive to keep quality employees also.
Yeah, I mean, absolutely. I mean, your total compensation package is a big part of it is your benefits structure, and most heavily in the public sector, we see that really, really prevalent, where they're really looking at the benefits and the compensation as the whole package of what they're getting from the employer. And so you're definitely on the very rich side of that. You can see with that actuarial table. I mean, you're charging almost half less than what your peers are, and your plan is another, 5% richer in actuarial value. So all great things to help people when it comes time to access the care too.
Yeah, I don't think it was done at the expense of your doctor. Sometimes you get a cheaper plan, you don't get the doctor that you've wanted. And with the providers network, we were managed to maintain doctors throughout all 4 states. And, it's It's working.
Yeah, Providers Care's done a great job of expanding their network and growing their network, and that's Karen Cox who leads that. They're out of Wichita, Kansas as well. Great outfit there that you're renting your physician network.
Thank you.
Great questions. Yeah, any other questions, you guys can always contact me directly. I'm happy to answer them, and we'll be back on that update on how the pharmacy's running. I want to give a full 12 months to show you the triggers we implemented there and how that's performed.
Great.
So we'll see after the first of the year. Hopefully, we'll be back to normal again.
Whatever that is.
Yeah. Thank you, Christy.
Thank you, guys. Okay, see you soon.
Thanks,
Okay.
Christy.
All right, moving on to special presentations, item B, conference center update. Hunden Strategic Partners, the consultant engaged by the City of Pittsburgh and Crawford County, will deliver their findings as to the market demand and feasibility of a new conference center adjoined to a hotel in Pittsburgh.
All right, thank you, Madam Mayor. You'll recall back in April, we talked a little bit about a big gap in our hospitality industry that has really become a big driving force of our local economy. And that gap is the lack of an adjoined hotel conference space here in our community. And we certainly see that with our close relationship with the Crawford County Convention and Visitors Bureau and their director, Devin Gorman, that we work with on a daily basis. We knew that there were a number of conferences and meetings that Pittsburgh and Crawford County were even unable to throw our hat in the ring because of an absence of that kind of space. But at that point, it was really anecdotal, and we knew that we needed some better data to go on to make sure that the demand was there. So what we did is the city partnered with the CVB on a feasibility study. We went and got the best consultants that look at this kind of information, and they're represented tonight by Rob Hunden and David Greisel. We're also very pleased to have with us Kansas Crossing Casino. The owner of Kansas Crossing, Bruce Christensen, and the general manager, Jeff McCain, are here with us. Obviously, they've been very interested in the results of this study as well. So I'm going to ask Rob to come up and talk about the findings of the study, and then Bruce to come up to offer the thoughts on behalf of the casino. So, Rob, I'll turn it over to you.
Thank you, sir. Appreciate it. Good evening, all, and thank you so much for having us here today. David Greisel from Convergence Design is based out of Kansas City, and our firm is based out of Chicago, but we both work internationally and mostly in the United States, and together for often for many, many years on many, many studies, including many in college towns like yours. So I understand that you have a long agenda tonight, so I'm going to make this relatively brief to give you the highlights. The full study is going to be provided. There are a couple of tweaks that we're making overnight, but overall, it was set up correctly. The question was the market and financial viability of a conference center that would join or be adjacent to a hotel. And just at a high level, one of the things that I can tell you is that when people build hotels, the reason you see rooms-only hotels pretty much everywhere, and it's hard to find a full-service hotel that's easily financed, is because the rooms make all the money. All the other bells and whistles, the restaurants, the ballrooms, the meeting rooms, all those things have very low profitability, and so they dilute the profitability of hotels, and so it doesn't, in many cases, make financial sense to build those, and so that's why you have a lot of rooms-only hotels all over the country, and that these kinds of hotels that induce meetings and groups and all that sort of thing are often a little more of a challenge, and so or you find maybe in bigger markets. So I'm going to take you through the headlines here and just talk to you about what we found. So first off, in terms of the local market, there are sort of 6 things, 3 on this slide, 3 on the next slide that I'll take you through. So in terms of the local market, you have a really interesting market in terms of where it's located and what you're made up of. First off, having Pitt State here is really a great thing. It's a great anchor for you to have. And the fact that you're actually, even though maybe a lot of people in the rest of the country don't know about you, you're a centrally located place that, especially for logistics and for corporate regional players, whether they're in-state or out-of-state, you're a place that people call up and say, hey, do you have a place that we can meet or have an event or something like that? And they're often turned away. So and a lot of that is related to the university too, but they don't have all the facilities that they need to accommodate these things either, or the size of facilities. So the market is, it's a good, strong market, and anytime you have a university like you do, it gives you a long runway for future economic development growth with high wage jobs and that sort of thing. So we like that in terms of where Pittsburgh sits in Crawford County and in the region. In terms of the sites, we looked at a variety of sites that David will take you through to understand where might be good opportunities to site such a facility based on size and all that kind of thing, but mostly adjacency to other either demand generators, adjacent supportive amenities like restaurants and retail and entertainment, but mostly that adjacency to the hotel, because we know that meeting planners, especially those who are going to be bringing in people from out of town, you want somewhere to stay, and they like those things to be adjoined in the same space. So we looked at a variety of sites, and we'll take you through that. The industry, as I mentioned, the Conference and Convention Center industry, as it were, is something that is primarily an economic development type of a building. It induces demand, it brings in demand, spending on hotels, restaurants, retail, other things like that, transportation. If those facilities can make a little bit of money, that's great. But typically communities and even the casinos and others get into those to bring in traffic to the community and not necessarily to make a bunch of money. So that's what we know about conference and convention centers nationwide, which we work on a ton, and many in university towns. People like to go to university towns to go to have conferences because they usually have a little bit more of a fun feel to them, a nice set of demographics, more restaurants, places to hang out, things like that. So that's another feather in your cap. In terms of the demand, we have seen that there's a lot of turnaway business, as I mentioned, from corporate conferences, rotating conferences. Once you get out of the Kansas City market and Wichita, there aren't a lot of places to rotate around. And the ones that you do find tend to be these smaller conference centers, and so you would be added to the mix if you developed something like this, at least for the small to mid-sized conferences and association group events. In terms of the supply, really what you have here is we sort of found a big hole in the kinds of things you have here. You really don't have sort of the traditional larger ballroom that's divisible with breakout meeting rooms and a full catering kitchen and that sort of thing. And where you do have that, which is on campus, their top priority is to book it with university events. So it's really not available most of the time for public and non-university uses. Other facilities here are more banquet hall types, or they're larger but maybe lower quality, or they're column-filled facilities, lots of columns. You don't have a lot of open spaces and that sort of thing. So there's a real gap in the current supply, and then you have to go to Joplin or beyond to get anything of any decent size or quality. So there's a gap in supply, and then we looked at a variety of case studies, and it shows that this kind of a development that we're recommending has been developed and has worked in a number of places. So in terms of your SWOT analysis, I've sort of discussed that already, that you're highly accessible. You have the casino, which is a great entertainment anchor, as well as the university, which drives a lot of demand for various kinds of events and activities. Strong city and county leadership. Of course, I have to say that, right? And you have affordable and available land. We're trying to do one of these. We're not trying to do one, but we're working together on one in Ithaca, New York. Let me tell you, you have a lot easier time getting things done here than you would in upstate New York for a whole variety of reasons. So there's a lot of opportunities here, and of course, there are always threats out there that somebody else is going to do it before you do it, and sort of pin you in a little bit, but in general, we feel like there's a lot of opportunity. So what do we recommend? So we recommend, and I know that's probably hard to read, so I apologize. How about I show it to you? So what we recommend is and this is sort of an agnostic box on an agnostic site at this point. So it's a grand ballroom of 15,000 square feet. Could be a little less if necessary, but we believe this fits the market. That seats 1,000 at a banquet, and could be divisible into, in this case, 7 different divisions. So you could have simultaneous ongoing events, which is actually quite common. And so you have your sort of build a church for Easter Sunday kind of thing with the big grand ballroom for larger events like expos and major conventions and maybe even entertainment events. But for the most part, you're going to be having smaller and mid-sized conferences and meetings, and a lot of those will overlap. And then breakout rooms as well to break out, so that when you go to a convention, as most of you probably have, there's a meet, greet, and eat function, and so all those things sort of happen in tandem, and so it's good to have that flexibility. And of course, a strong catering kitchen and robust pre-function space to really support the registration function, cocktail receptions, that sort of thing. So that's the concept plan. And then I will turn it over to David to talk about some of the test fits that he did.
Hi, David Greisel with Convergence Design. We work with Rob on a lot of these studies, and we're kind of doing the planning and design part. So what you see here is a diagram of the Kansas Crossing site with a hypothetical conference center located kind of on the southern part of the property with some additional parking south of that. There's, as you may know, a lot of developable land around the casino site, so locating a conference center on this site was actually very easy. But a couple of things I like about this: one is that you can directly connect to the Hampton Inn and Suites that's there right now, the orange block that kind of runs north and south on the east side. There's also lots of room for future expansion of either the conference center or even to add additional hotels in the future should the demand call for that. So there's a lot of possibilities, and there's additional land around the perimeter of the site for future development to occur, whether that would be retail or restaurant or whatever. So a lot of good things happening on this site.
Yep, and then, okay. So, yeah, you want to talk about cost estimate?
Yeah, so this is a real high-level cost estimate, and we just want to give you a sort of picture of order of magnitude cost of what a development of this type would be. So, you know, what I say order of magnitude means, like, is it $1 million, $10 million, or $100 million? That's what we're talking about here. So we think order of magnitude, this is about a $24 million project. Which includes 19 in hard construction cost and another 5 in soft cost, which is fees, furnishings, equipment, that kind of thing. So in round numbers, that's what we're talking about for a size of a building like this. And these square foot costs are very generic, but again, referencing the Ithaca project, I can assure you that the square foot cost we're using in Pittsburg, Kansas is considerably lower than the square foot cost we ended up with in Ithaca, New York.
All right, thank you, David. And then in terms of, boy, talk about things that are hard to see. And we didn't do that on purpose. So yeah, typically these projects run at about break even. They can lose a little money, they can make a little money. The Overland Park Convention Center, which is much larger, is one convention center that actually makes a decent amount of money on operations every year. But for the most part, as I mentioned, they are inducers of economic activity, and so you want to keep them lean and mean in terms of your operations. But you'd want to be considering that as you move forward. Now, we also ran 20-year fiscal, economic, and job impacts for the project. And here what we did is we only counted net new, because I know a lot of people say, well, isn't some of this going to shift existing supply and demand around, not supply, but shift existing demand around in the marketplace? And the answer is yes, there would be a little bit of shifting that always occurs when something new and different comes along. However, most of this, the reason we designed it this way was to induce things that can't be accommodated here now and that would be inducing from outside. And so the only spending we counted was the net new to Crawford County. If it was net new even to Pittsburg City, then these numbers would be even a little bit higher. So you see here over 20 20 years, 82 million in net new direct spending on hotels, restaurants, retail, transportation, etc. Net new earnings, typically about a third of that ends up in somebody's pocket as income. And so then the new full-time equivalent jobs supported by this are about 40. Those are not necessarily on-site jobs. Those on-site jobs will maybe be 10 to 15, and the rest are supported in local community restaurants and retail and things like that. The fiscal impacts over 20 years, we've estimated, I think it's pretty conservative, about $2.5 million. And that does not include any real estate taxes, assuming it was a private venture. So that's just the local portion of the sales tax, county and city, as well as the hotel tax. Then there's, of course, the one-time construction impact, which could be significant, obviously. With that, I feel like I wanted to just briefly have David take you through the sites that we looked at. We did end up favoring by a little bit the Kansas Crossing Casino option for some reasons that David can talk to you about. During the study process, one of the sites actually fell out of being even available, but he can certainly take you through those four.
Okay, so real quickly, the 4 sites that we looked at are the hotel cluster at the north end of town. There are certainly several hotels in proximity to where a conference center might go there. The primary issues with this site were, one, the conference center site would be way back off the road in a very hard to find location, which is not good for a significant investment. The other is that while there are several hotels and restaurants in this area, they tend to be very disconnected physically from one another, and they're you have to drive from one to another, so it doesn't really, even though there's a lot of things there, it doesn't really create a very effective destination for a convention goer. The second site we're looking at here is on Centennial Drive, just immediately south of the La Quinta. Turns out the site that's labeled site on this map is too small to hold the conference center and required parking. So we looked at the future development area to the south of that, but that area turns out to not be as available as we thought it might be. So this one kind of got nixed on practical grounds. Then the Kansas Crossing site we've already discussed. And then the fourth site we looked at was to just ask ourselves, could this facility be located downtown adjacent to Memorial Auditorium? I guess theoretically it could, although it's very crowded and would be kind of more like the Ithaca project we were talking about, where we're trying to jam it into an urban site where it doesn't quite fit. And the lack of a current downtown hotel would be a severe detriment to this project and would very much negatively impact its viability if there was not a hotel, either adjacent or less than a block away.
Yeah, so I think that's the end of what we wanted to sort of talk about today. And we do appreciate, really, I sort of made a joke out of it, but it's true, the fact that both the county and the city, as well as the CVB, have been so helpful, as well as all your hoteliers and everybody in town, really, that we spoke to, has been really, I think, very positive about the desire and need and opportunity out there, and very, I always say the X factor in any of these projects, because these can be difficult to get done, is leadership. And so when we say strong leadership is a pro, is a strength, we mean it, and we're not kidding, because it's really critical, as you know, having gone through other projects like this. So I would say kudos to that, and I would be open to any questions. I know you have a busy agenda.
I have one question. Back on page 12,
Yes, sir.
bottom line. This project will require ongoing subsidy from the public sector.
Yeah, so that's probably something I'm going to want to tweak. So good eye though. So typically, as I mentioned, it can be from whomever the project sponsor or sponsors are, and in many cases it's a nonprofit, in many cases it's a casino, in many cases it's a consortium, and also in many cases it's the public sector. So we will sort of put that out of commission in terms of that reference, but
Rob, would it be fair to say that from year 4 going forward, this thing is operating at a virtual break even?
that would be fair to say. I think we're conservative in our estimates, and of course, those first ramp-up years, we assume that it will, need a little bit of love, but once you get going, you should be able to get pretty close to break even, which we recommend, and I would expect that if you were involved, you'd expect that too.
Okay, thank you.
Yes, sir.
Any other questions?
Bruce is going to say.
Oh, okay. Bruce, did you have a few words to say?
Thank you. I wanted to thank all involved, the city, the county, and everybody else involved for putting this study together, paying for it. Thank you. We're very pleased to be selected as a preferred site, and we're very excited about it. We have not, I just received it a day or two ago, and I've been traveling, so I haven't fully absorbed it, but it looks like there may be more demand there than we would have thought. And very excited. I'm going to get with my construction team and see what we think about costs. And my initial reaction was it's awful expensive, but we're very interested in pursuing something, and we look forward, as we always have, to working with the city and the county and everybody here to try to make something that will be successful, because it could certainly be a big help to the community. It could be a big help to our facility, and it could be good for everybody. So we look forward to pursuing it further and seeing if it can be downscaled a little bit without doing away with the advantages we might have, but getting more people into Crawford County and Pittsburgh is good for us, and it's what we'd really like to accomplish if possible. So thank you very much.
Bruce, I have a question.
Sure.
Do you have any of these conference facilities in any of your other locations?
Yes, we have some, and I'm going to verify. Every community is different, but I have a couple I can check on to see if we think after a few years we can achieve these kind of numbers. I have not done that yet, but there's most of these statewide organizations, they like to rotate, and it takes you several years to get up, but we'd really love to have the KBA and everybody else, coming to Crawford County. So I'll do some verification, and we'll be back with everybody, and I appreciate you guys selecting us as the preferred site, because we agree with that, by the way. Thank you all.
Thank you, Bruce.
Thank you, Bruce.
So, Madam Mayor, just to put a bow on it real quickly.
Sure.
Because I know the question may be from you or from members of the community, what's next? This was really just the first step, again, to see if the need was there, and I know the numbers are big. I do think it's a testament to our community and our economy that an outside consultant thinks that we could support something that big, from a community standpoint. But as far as what's next, we'll now engage Bruce. We'll certainly engage Devin and the CBB to figure out what something like this could look like. So as Bruce said, we'll continue to investigate it. And one other guest that I forgot to recognize is Ginger Cawley. She's the sales director at the Hampton Inn. She sees firsthand the number of business travelers, local businesses, outside businesses that are using our hospitality community, and they're commonly requesting a space like this, so she sees that demand firsthand. But again, thank you for your time, and look forward to more investigation.
I have one question. So is our engagement with Hunden Strategic Partners completed?
Yes, ma'am.
Okay.
Yes.
Well, thank you to Rob and Dave.
I have one question for Rob.
Okay, sorry.
When you've done these studies before, have you ever turned down a location as not viable?
Yes, yeah. And a lot of times, when you put the numbers to people, and so say they're thinking, hey, this is going to make a bunch of money, you say, no, what this really means is economic impact, and it's a break even, then they sort of decide, well, that means it's not feasible for us. So a lot of times the definition of what each client thinks is feasible is a little bit different. Some go in with eyes wide open, and others it's a shock. But there are times when people say, hey, we have this great idea, it's going to make a fortune. We hear that a lot with youth sports complexes, because those two we do a ton of those studies, and they're very, very impactful, extremely impactful. but they don't generally make a lot of money. And so you get a lot of fly-by-night folks that think that. So we have to give them the bad news. And we're used to doing that. That's why we stay in business, because we tell the truth. Now, one other thing I will say is, the caveat on this is, if you build it doesn't mean they will come. It's got to be absolutely expertly managed and marketed by people who know what they're doing, and you got to keep the costs lean and mean, and you got to have kick butt catering. So I think those things need to be stated so that you're not just assuming that you'll open up the doors and all the lights will come shining through. So I just wanted to mention that.
Thank you.
Great, thank you. Thank you for helping us through this.
Yeah, absolutely.
All right,
I have a question for Ginger.
sure.
Ginger, I have a question for you, if you don't mind. Ginger is at the Hampton Inn all the time. You see the clientele come and go and what's going on. What are you, and you have conventions and you share and send conventions to other places in town, to a number of us. So I know you're doing a lot of that. What are you hearing from the clientele and those that are out there now?
We discussed this in detail earlier today. There's an absolute need from it, from existing corporations that are traveling through. I don't think that there was an expectation when we first opened that there would be as much corporate travel as there has been. I mean, during COVID is a prime example. Our occupancy at lowest was 46%, and that was in July, because of the corporate-based business that we have that's so strong. There's also a huge untapped market with conventions, associations, rotational meetings on those 2 year, 4 years. There's an exhaustion of venues as far as options that are available. So there's definitely a need. There's a lot more of those types of venues that we could accommodate so far as impacting more of like the destination leisure travel on the weekend. But that sweet spot, which has a huge need for, and breakout rooms that can be simultaneously hosted at the same time, is not available right now. So we turn away business, we refer them. They have to go to different markets like Kansas City, Wichita, to be able to host these events when they're looking for somewhere like us.
Thank you.
Thank you, Ginger.
You guys made me so nervous.
We're a
I
friendly
think this
group.
is a question for Rob, but I don't know. Is there so currently we're at where we are, and there's a report that you've prepared that says that for the small sum of $24 million, we could be somewhere else, which is great to know, because I think knowing the potential of your community for people like Bruce and Ginger and people that have businesses here that are invested in it, to know what their upside could be if they wanted to put more money in. Is there anything in the middle? Can you talk for a second about, is there a need for, is there a 10,000 square foot? Is it just all or nothing on this case? I mean, how does this kind of analysis work from your point of view?
No, I appreciate the question. It's not all or nothing. The way we size it, obviously, I sort of look at it as like a pottery wheel. You got to come at it from a lot of different angles, or petals on a flower, and they all sort of point you towards the answer. And one is, we look at what do you already have that you don't want to cannibalize in terms of existing venues. So we wanted to make sure it was bigger and different and more flexible than anything else that you had. And if you get too small, you're really just duplicating what you have. So, I think you could go down a little bit, but you don't want to go down too much. Also, you don't want to go too big. That doesn't seem to be the question today, but obviously if you build it too big, you're going to be empty and you're going to be having utility costs and all that, and lose money. So you don't want to do that. So that's how we sort of pushed it to where it is today. However, what we did talk about in sort of a little pregame this afternoon was just the ability to, let me just show you the plan just as an example. The thing that you want to still be able to do is have that flexibility. You want to be able to have simultaneous events going on. You could do that just with that grand ballroom, and remove the pre-function space back of house and of the sort of the junior ballroom, or that meeting rooms of 6,000. And if you did that, you'd probably save yourself 25 to 33% off the total building size and cost, and still be able to get the majority of both big and small events that you would need. And not to mention, you have, certainly at the Kansas Crossing Casino site, but even in some of the others, there are some additional little spaces that people could utilize if they needed to tuck away. So You know, it's not an all or nothing, and if you needed to squeeze it down by a quarter or a third, I think you'd still get most of the bang. Obviously, this is what we believe is ideal. So I think you have some wiggle room there.
Thanks for that.
Yep.
Thank you. All right, and thank you to Blake and Devin for shepherding this through. All right, seeing no other, thank you for being here tonight. Moving on to special presentations, item C, Kim Vogel, Director of Parks and Rec, will present the updated conceptual design budget and timeline for the Schlanger Park Splash Pad project. Hi, Kim.
Good evening, Mayor and Commissioners. If you will remember back in January, I was before you to ask for you to accept the Land and Water Conservation Fund grant that we received. It was a 50-50 matching grant for this splash pad project. And then back in June, we were here to award the bid for the splash pad project to Sunscape Pool and Backyard, which is a division of Home Center Construction here in Pittsburgh. So I put this first slide up to show the public, to remind the public where the project would be, and that is at Schlanger Park in the location of the existing fill and drain pool. We will be demolishing that pool. Actually, staff is starting next week on the demolition of the fencing and that pool that is there, and the site of the splash pad will be right there on top of the current pool. The conceptual design for the splash pad has been done, and it's taken us a little while to accomplish this task, obviously from June to now, for a few reasons. And one was because when we awarded the bid, we knew that we still had some other potential funding sources that were out there, and we wanted to make sure that all of those awards or rejections were completed before we went forward with our final design with Sunscape Pool and Backyard. And so that has been completed. We did, after receiving the Land and Water Conservation Fund, did receive two other grants, one small grant from, but very significant, from the Sunflower Kiwanis here in town, and then that was a $5,000 grant, and then a roughly $45,000 grant from Livewell Crawford County Livewell Crawford County that was part of their Pathways to Healthy Kansas grant funding. So we're very excited to receive nearly $50,000 more on top of what we came to you originally with. So with that, we were able to add a few features and able to make a better facility that our circulation system will be in. So that will be now a concrete facility instead of structure instead of what we had originally proposed. So there were some few changes to the budget, but they were all covered with grant funding. So this is the final design for the project. We're pretty excited about this design, and let me show you how the zones are set up with splash pads. So, or with any play structure. So this shows the different use zones for the splash pad, and every pool company, aquatics company that sells the features have a little bit different way of going about it. But with Water Play, who we went with for our features, they zone their equipment in adventure zones, development zones, and discovery zones. So on the slide, you can see the different features that are in those zones that we have chosen for the project. The adventure zones have the taller features that will have the water cascading down on them. The development zones will have the smaller stones, the little smaller waterfalls where the smaller children can sit and play. And then the discovery zones will have the waterways and the interactive puddles that children can jump on that will make them, the harder you jump, the taller it goes. And probably the most exciting feature in the whole thing, at least for us, definitely the most expensive feature in the whole thing, is the water table that has the three arms coming out of it. It can accommodate up to 16 children. That was probably a pre-social distancing number, but 16 children to stand there. There are 3 different levels on that interactive water table, and they have different features on it, so they can move things around and it slows the water down or speeds the water up. So really excited about the final design that we have come up with. The final budget for the project is going to be just under $344,000. So I'm excited about all of the funding that we have raised for this project and the ability to do that. And definitely like to thank the community for the donations to Everybody Plays that have continued to come in throughout the years that the Everybody Plays Task Force has been working on all of the amenities that have went into Schlanger Park. We, like I said, we are starting with some demolition this week, and that'll continue for several weeks. And then it'll be about a 120-day build for the project. So, and that's 120 working days, and that's weather pending on those working days. So, hoping to have the splash pad up and running by the same time that we're having the aquatic center up and running next year. So mid-May, 1st of June is our estimated goal. Are there any questions?
Yeah, I have one. What's the total number of children that could utilize this in a safe manner?
That will utilize it?
Yeah, the whole park.
All of Schlanger Park or just the splash pad?
Just the splash pad.
It's roughly 2,000 square feet, so we'll just take that into consideration. But with all of the different features in there, I would say probably at any time, probably 60 plus children at any one time. Any other questions?
No questions for me.
It looks great. It's exciting. Yeah.
Thank you.
Thank you,
Kim, real quick, just thanks to you for the grants.
Yeah.
They don't just come rolling in because people are bored. Somebody has to go out and ask for them. And the fact that you've added another 50,000 onto what was going to happen already, just appreciate all your effort and that you continue to make great projects like this for everybody in the community. So thanks.
Yeah. Thank you. Thank you. All right, moving on to consider the following. A, E&J Investments Development. Consider the recommendation of the Economic Development Advisory Committee to provide an additional $36,779.98 from the revolving loan fund to be used toward the extension of utilities to serve the E&J Investments Development and prime the area for future growth.
All right, thank you, Madam Mayor. You'll recall that back in January, we brought you an incentive package request to support the expansion of Renew Medical Spa. That's Dr. Jackie Utsis. It's a great project, $1.2 million. It's actually within, I believe, a week of her being able to receive new patients or receive patients at the new facility. As part of that incentive package, we were proposing that the city would cover the cost of the utilities to be extended to the new site. At that time, we were estimating those utilities would cost about $20,000. For some reasons that Matt will explain, that number ended up being higher, so we're coming back to you to ask for an increase in that. But with that, I'll ask Matt to maybe shed a little bit more light on why those numbers are a little higher.
Mayor's pictures.
Give me Matt.
So this project has progressed from what its original intent was. In the corner down here is the original manhole. We were going to go underneath Centennial to tie sewer just for her facility, just the office building that she was building. However, that office building is in the southeast corner of that property. And so she has the additional 20 acres up there to develop. As the project progressed, she acquired the property to the east of her, where you can see our big sewer main trunk line that goes down the southeast lift station. She also engaged Earl's Engineering to work on development for that future remaining property. So Earl's put together a number for us to look at the depth of the manhole to service the whole entire property. That property, after the termination of that, to get into this manhole in the corner, have adequate depth for the property, we would have to dig up Centennial, tie into that. So we pulled across and we came and put a new manhole in the sewer main and drug that line up with the proper depth of that sanitary sewer manhole to service that entire property through that main extension. The request tonight also includes some extension of about 200 foot to the north to serve across the face of her property, because it will be between the future or the current roadway that's going in on the approach and where her building is. So the additional request tonight does include some future growth across the frontage of that property, so she can go ahead and landscape that up and clean it up and then tag on to the north side of the property for the next adventure.
Sounds like a good plan not to tear up Centennial to me.
We kind of thought so.
So obviously, since this was more than was originally recommended by the EDAC and approved by the commission, we took this back through the process. We took this back to the EDAC at their last meeting. They felt like this is a great project that they wanted to support, so they did unanimously recommend to allocate an additional $36,779.98 to not only support the utilities to the current site, but as Matt mentioned, to prime the area north for future development.
So our total involvement is?
$56,779.98 for the utilities.
I don't have any questions.
I think it's a good plan to have right now, because I know she does have some future development plans out there. It'd be a good time to put that in before development gets started.
Agree completely.
Any other questions for Matt or Blake? I would entertain a motion to approve.
I'll make a motion to approve.
Moved by Chuck, seconded by Larry. All those in favor say aye.
Aye.
Opposed, same sign. Motion carries. Thank you, Matt. Consider the following item B, Turnkey Developers LLC reimbursement schedule modification. Considering the recommendation of the Economic Development Advisory Committee to modify the reimbursement schedule with Turnkey Developers LLC, in which the timing of the second half of the reimbursement to Turnkey Developers LLC would change from the completion of Phase 1 to the construction of 10 new homes.
Okay, thank you again, Madam Mayor. This is in support of the Creekside East housing development. You'll recall back in July, the recommendation that we brought to you was that the city help with the cost of the entryway into that development. The agreement would be that they would front the cost of that, then be reimbursed half upon completion of the road, with the additional half being reimbursed at the end of Phase 1, which I believe was either 20 or 26 homes. As Turnkey worked with their bank was a little concerned that timeline may have been a little too long, and so they came back to us and asked if the city would consider everything staying the same except for that second half of reimbursement would be reimbursed to the developers after 10 homes were built instead of at the end of Phase 1. So again, we took that back to the EDAC. They felt like 10 new homes in Pittsburg, Kansas, that's progress in most people's book, and so they felt like that was appropriate, and that's the recommendation that we're bringing to you, is that the second half reimbursement would happen after 10 homes are built inside Creekside East.
And I'm sorry, repeat again, what was the total number of Phase 1 homes? Do we remember?
It's either 20 or, I believe it's 20,
Okay.
yeah, 26.
A little less than half, okay.
And some of those homes aren't served by this road, correct?
No, the amount of homes in Phase 1 that will be accessed by this road is 20, so this would actually be 10 less than that.
I see.
The additional 6 homes are coming in from Deer Run, which
Right.
will not access the Phase 1 road.
Are them additional 6 homes going to be built along with this Phase 1?
Any other questions?
No questions.
I would entertain a motion to approve.
So moved.
I second it.
Moved by Patrick, seconded by Chuck. All those in favor say aye.
Aye.
Opposed, same sign. Motion carries. Thank you. Okay, item C, annexation request. James L. Barone, consider the request submitted by James L. Barone to have his property located on South Rouse annexed into the city of Pittsburgh.
Thank you. We received a request for annexation. You'll see this large green field here just south of the Pinnacle subdivision. That is the property that's being requested to be annexed. Staff has no objection and is in favor of the annexation request.
Any questions for Karen?
I do. The property to the south, it's already in the city limits, isn't it?
You've got Pinnacle Point subdivision is inside the city, and then this area here is outside, and then get down to the Deer Creek, that is inside. So this is
Okay.
part of that gap that's outside of the city limits.
If there's no questions, I move approval.
I second.
Moved by Patrick, seconded by Cheryl. All those in favor say aye.
Aye.
Opposed, same sign. Motion carries. Thank you, Cameron.
Thank you.
Moving on to item D, Rural House Incentive District. Consider staff recommendations to establish a Rural Housing Incentive District, RHID, and adopt resolution number 1238, determining that the city is considering establishing a Rural Housing Incentive District.
Okay, so similar to the process, I believe it was 2015, to establish our first round of rural housing incentive district eligible properties, we will need to pass this resolution, which will then go to the Secretary of Commerce for approval. And once that is approved by Secretary of Commerce, then these new properties are eligible to receive the RHID benefit.
Is there any limit to how many of these RHIDs we can have?
No.
Is any of these new possible projects in flood zone or?
None. Some of them may have partial flood zone in them, and they would have to go through the county process of getting a LOMA and all that. If they were going to build in that flood zone area, they would have to go through that process.
A developer would.
The developer, yeah.
What did you mean by 2015, you said?
When we originally started the first RHID.
The first one?
Yeah.
Which property was that back then?
There was quite a few of them, I think.
A few?
Yeah, I think if you look, you can go online and look at our map, and it shows the RHIDs that we.
Yeah, so what this does, it doesn't mean that these are going to be developed. It just means that they are now eligible to go through the process. So currently these properties, and I think Gary's in the audience here, so one of that parcel of Pinnacle there that is not currently in the RHID is not currently eligible to receive the benefit of the district. So if Mr. Dennett were to develop that, he would not have the benefit of the RHID unless this resolution is passed and accepted by the Secretary of Commerce.
So are there state criteria that drives what parcels of land we can designate as an RHID?
Our county's approved. I believe it's a county of less than 60,000. Yeah, a city with a population of less than 40 and a county of less than 60,000 are all eligible to receive that.
Any other questions for Quentin?
I do.
Yep.
So when you gave us this paper,
Mm-hmm.
the red, or is it pink I'm looking at, you said south of Pinnacle?
Sure.
That's not.
Is it an outline parcel?
In the blue?
Yeah, just the outline parcels would be eligible.
Okay. So the difference between the blue and the pink color?
There's no difference. It was just to show
Oh, just to show the difference.
just to
Okay.
show different parcel numbers.
Okay, thanks.
Any other questions? Entertain a motion to approve.
I'll make a motion to approve.
I second.
Moved by Chuck, seconded by Patrick. All those in favor say aye.
Aye.
Opposed, same sign. Motion carries. Thank you.
Thank you.
Quentin.
And if I could just
Sure.
rattle off one fact. If you were at the Economic Outlook Conference today, you were probably excited about what has been done here in Pittsburgh and what the future looks like for Pittsburgh and the state of Kansas as a whole as far as real estate goes. The Center for Real Estate is an organization based out of Wichita State that studies these things. And new construction numbers for new homes were up 12.1% from 2019 and 2020, and they're projected to be up 21.6% from 2020 to 2021. So
In what location?
in the state of Kansas.
Oh, in the state of Kansas,
Yeah.
okay.
But that 21.6% is the highest projection they've had in the last 10 years of new construction. So.
Thank you.
We're adding to it. All right, moving on to item C, water treatment plant forklift. Consider staff request to waive the city bid policy to purchase a used 2014 Moffett M55.4 four-way forklift from Equipment Remarketing LLC from Grable, Indiana, in the amount of $31,985 for the use at the water treatment plant to declare the current forklift being utilized at the facility as surplus property and to authorize staff to dispose of the forklift through the online auctioning services of Purple Wave, Inc. Matt?
Good evening, Mayors and Commissioners. We use a forklift out at the water treatment plant to move chemical, help with our acid wash system. It needs to be, we use it outside, moving things around. We also use it with part of our traffic department for different odds and ends out there as well. So we felt the best fit for us for what we need to meet that need was this used model of forklift. It will be paid for through the utility operating funds.
And what does it mean to waive the city bid policy?
Well, typically you take 3 bids over a policy of $20,000. This request is for 31, and so we are buying a used piece of equipment versus a new. So we're asking for your blessing for that.
That was gonna be one of my questions, Dawn. Why do you waive it? But it sounds like you waive it when you're buying something used over something new.
Yep.
What would something like that new cost?
For what we need, we'd be looking in the $65,000 to $70,000 range.
Any warranty with this machine?
Yeah, we carry a minimum 1-year warranty.
Okay.
So, and it's been gone through.
Any other questions on the forklift? I'd entertain a motion to approve.
Motion to.
Moved by Larry, seconded by Chuck. All those in favor say aye.
Aye.
Opposed, same sign. Motion carries. Thank you, Matt. Apparently, we're going to be seeing you for a few minutes here. F, Municipal H2O Services Agreement. Consider staff request to waive the city bid policy to enter into a contract with Municipal H2O in the amount of $24,500 for assistance in consulting in preparation of the completion of items related to the American Water Infrastructure Act.
This is another, we're asking for the waive on this policy as well because it's over $20,000. We currently use Municipal H2O for our risk management program. This kind of incorporates into their wheelhouse since they're already working on that. I provided a lot of information in the back of the binder. This is tied into it, you know, the move of Homeland Security and the EPA. So this is kind of some unfunded mandates and a lot of, we would love to take this on ourselves, but it's pretty daunting and you got to make sure you know what they're doing. So we did get another proposal from Burns McDonald's, who was out there originally, and then I've talked to some other of our consulting engineers, but really Municipal H2O, we went through it a lot with them, and I've provided a lot of their backup and experience with what they have, and we feel like comfortable moving forward with them for the consulting needed to bring this together. I mean, it measures all our services, our risk management, emergency operations plans, cybersecurity, a lot of different factors in assessing our facility.
So the end product will be a document that will meet
Submitting to the EPA, yes.
Any questions for Matt?
If there's no questions, I move approval.
Second.
Moved by Patrick, seconded by Cheryl. All those in favor say aye.
Aye.
Opposed, same sign. Motion carries. Thank you. Item G, Building Services Truck. Consider staff request to waive the city bid policy to purchase a 2021 Ford F-150 XL two-wheel drive rig cab truck from Mike Carpino, Ford of Pittsburgh, in the amount of $23,600.
Once again, I don't think it made it to the agenda. I think I forgot to attach it. We did price through through Sourcewell and the National Auto Fleet, their division of that. That cost for that truck came up to $25,980. Obviously, Mr. Carpino is now part of the city of Pittsburgh, and he came in with a bid of $23,600. So we'd recommend award for that truck. And it was paid through the STCO planned operating, or STCO fund. It was a planned capital purchase for this year.
Any
If no questions, I move approval.
Okay, moved by Patrick, seconded by Larry. All those in favor say aye.
Aye.
Opposed, same sign. Motion carries. Moving on to item H, purchase of the 2020 capital vehicles equipment. Consider staff request to waive the city bid policy to purchase 2020 capital vehicles equipment utilizing state contract pricing and to send out an RFP seeking quotes from financial institutions for the financing of these vehicles equipments based on a 5-year lease purchase.
On this request, we are asking for, we've priced out our Freightliner dump trucks. One is for our water distribution division, and then that truck will pass down through our fleet. The other is for the wastewater treatment plant. It's the truck that we haul sludge with out to the farms and through there. Right now, these purchases will be financed through the financing document. I have a bunch of other equipment that we're going to take bids on in the 1st of November. However, I need to get I'm asking for a blessing of this purchase through utility operating because of the fact that they only hold the pricing through the end of October if I don't tell them to move ahead with it. So that's what I'm asking for tonight. If you accept the state contract pricing that we've used for our other dump trucks for streets and those type of things. These are Freightliner model trucks, chassis.
So you already have the truck, you're just wanting us to?
I'm going to finance them. There's the financing module to pay these because the financing is so cheap right now. That document's on the street for our lending institutions, but we don't take bids on it till after the 1st of November. And the pricing for these 2 Freightliner chassis, to hold the price where it is right now, I have to give them a go or no go before the end of October. We'll move into next year's model and a potential price increase.
So where would these come from?
Currently, the quotes that we have are from Wichita Truck Center, the Freightliner dealer that we've got our last couple of trucks from.
Any other questions for Matt?
No, 2 trucks, Matt?
Uh-huh.
Yeah. I don't have any questions. Matt.
Move to approve.
I second.
Moved by Cheryl, seconded by Patrick. All those in favor say aye.
Aye.
Opposed, same sign. Motion carries. Thank you, Matt. All right, item I, emergency repairs to Lincoln Center HVAC. Consider staff request to waive the city bid policy to make emergency repairs to the HVAC system at Lincoln Center. Repairs to be made by CDL Electric of Pittsburgh in the amount of $42,804.
Mayor and Commissioners, this project has been our capital improvements plan for a couple of years now. We've continued to kick the can down the road for this, and well, we're done kicking. These units are failing. The heat exchangers are gone. The interior's sheet metal is gone. These units were put in 96, so they're 25 years old. They supply both the main auditorium of the Lincoln Center. They're in the north end of the building where the stage was at, and there's 8 of 96 on the serial and 10 of 96 on the serial numbers of these units. So they are done. They have, because of the condensate, the way it's setting up, it has leaked through on the existing structure, has damaged the roof of the kitchen, and they just got to go.
Shot.
So we took an emergency. We got a quote from Satterley's as well, and priced these units out. And so we're gonna once again, because the item is over $20,000, we're asking because of the emergency repair to go with the contractor quotes.
Why are we calling this an emergency repair?
We've nursed them along
I
for that.
understand, but you're asking us to waive the city bid policy. I don't know. Is there a reason we're not getting 3 bids?
We didn't have another contractor interested in. I mean, Satterley has done some of our bigger work as well as CDL on those parts, large commercial units with local representation. I mean, why we went to the 2 that we went to.
I think it became an emergency. Like Matt said, these things, in a normal financial world, you'd replace them before they broke. When they've broke to the point they are right now, and they're damaging the building, they became an emergency about 3 weeks ago. And that's why they're showing up to you as an emergency.
So if we didn't replace them because of the emergency, we would have more costs to the taxpayers for the damage there.
Yeah, I mean, there will be no heat or air conditioning in Lincoln Center until these are replaced. They are non-repairable.
Once they get started, how long?
Ordering the unit, I'd imagine, is going to take 8 to 12 weeks, like a typical confining with to get the units in themselves, and then just rip them out and put them back in from that standpoint.
Wow.
Well, I know CDL, on a smaller scale, I had to replace my heating and air conditioning unit, and they did it cheaper than most people got bids on, and they did a great job. So If there's no further questions, I'll make a motion to approve.
I'd second.
Moved by Chuck, seconded by Larry. Any further discussion? Did you get your question answered, Patrick?
I had just one.
Okay.
When you mentioned the roof, has it been repaired already, the roof? Or
It was the
leaking?
interior structure of the kitchen.
Oh,
The-
interior.
I'll show the
Ceiling.
The
Okay.
ceiling of the kitchen. These units are set up. The units are put in what was the old stage area of that, and so they were kind of custom fit in there. These units set on a piece of OSB on top of the framing of the roof rafters for those rooms above the kitchenette and the women's restroom. And because of the interior metal failure and rusting,
Yeah.
to get to those units, they begin to leak and
Yeah.
condensate down through that and destroy the sheetrock through those ceilings, and that would be a continuation until we get those units out of there.
All right.
Yeah.
Any other questions? There's a motion on the table. I would enter, all those in favor say aye.
Aye.
Opposed, same sign. Motion carries. Thank you. Matt, thank you.
Good job, Matt.
Thank you, Mayor and Commissioners. I will leave the podium.
All right. Matt has left the building. Spyglass Snapshot Audit Agreement. Consider staff recommendation to enter into an agreement with the Spyglass Group LLC in which the Spyglass Group LLC will analyze the city's primary telecommunications services account, voice, data, internet, cloud services, and mobility/cellular to seek cost recovery, service elimination, and cost reduction recommendations.
You're just glad it's not Matt anymore, right? This is, this service is available widely across the state and for a number of reasons, but there's specialists in analyzing telecommunications bills, which get pretty complicated pretty quickly. They have federal and state laws associated with them. We've tried to analyze the bills ourselves, and we can't always decide whether or not we're getting billed for the right things. We did this about 5 years ago, and we were able to save over $10,000 just because they were charging us incorrectly, not following rules and not giving us the right kind of fees. We feel we should do this on a regular basis. There's no cost associated with this. We simply split the savings with them, and that's how these agreements work. But we do need to get it approved by the city commission and have the mayor sign it to enter into these agreements.
So telecommunications, it's just, you're talking cell phone usage for all departments?
It'd be Verizon. It's also internet. We have a Cox account that they'd be looking at, and AT&T. We have several telecommunications accounts, and they get real complicated, and the laws change, and sometimes they don't. I know it's hard to believe, but they don't reflect all of those changes on the bills sometimes, and we're due money back. So that happened last time we did this about 5 years ago.
You said this is no cost to us?
There is no cost to us.
And this is for 1 year, or what is?
There's an initial, they look at it initially, and if we're owed money back because they've been billing us poorly for the last 5 years, we'll split that with them, with the company. And then if they find an error on the monthly billing, in other words, they've been overcharging us on the monthly billing, then we'll split, we give them the difference in that for a year, and then we realize all the savings after that.
So my question would be, then after the year's up, you'd come back to us again for?
No, we don't have to do that. The agreement will be with them. We'll pay them what the savings is for a year, and then we realize all the savings ourselves after that.
Then you regroup and go with somebody, I mean, if that's the case, then you regroup and...
We can, but usually when one of these companies gets caught that they've been overcharging us, they just simply change their bill, and we get a lower cost on a monthly basis.
So it's really like having an external auditor come in.
It's indeed an audit. That's what they're doing, and it's an audit done by experts. We just don't have the knowledge to be able to tell if they're billing us properly.
What's the average monthly bill for something like this? 40,000? More?
Oh, it's more than that.
More?
We have a lot of accounts with Verizon. We have AT&T that does some of our public safety, that does we have 3 different services that AT&T provides us. Verizon does most of our cell phones that we have, and then of course we have CanRen is our internet provider. They're the internet provider for the Regents universities. There won't be any savings from that, but we also have some Cox bills that are left over from other things that we use them for. we like to audit that regularly.
Any other questions? Okay, I entertain a motion to approve.
So moved.
Moved by Larry, seconded by Patrick. All those in favor say aye.
Aye.
Opposed, same sign. Motion carries. Thank you, Jay. And saving the best for last. Ordinance number S 1073. Consider adopting ordinance number S 1073, levying an additional city retailer sales tax in the amount of 0.5% to be levied for a term of 10 years within the city of Pittsburgh, effective April 1st, 2021, or the next available date, with the revenue therefrom to pay for the maintenance and repair of city streets, and not to exceed $100,000 annually to pay for sidewalk repair matching fund for property owners.
Mayor, city commissioners, and maybe more importantly on this one, everybody listening at home that voted, we had a successful election due to, I think, a good plan that you all put together that we were able to put in front of the voters to combine these two taxes. As you remember, when we presented it to you, Henry walked us through a number of things that need to happen to actually make the final outcome be what we want. The first was a positive election, which we had. This is the next step. There will be a couple of ordinances to follow, and if you don't mind, Henry, I'll probably turn it over to you to walk through what's remaining to make sure that we do this right.
Yes, one of the things that we'll have for you at the next meeting will be an ordinance that repeals the ordinance that was for 1/4 cent that this one is going to replace. So that'll be the next step. Tammy will send this ordinance, provided it's approved, to the state, and they'll begin collecting the new tax hopefully on April 1st, 2021, and so we'll come to you with an ordinance to repeal that other tax effective March 31, 2021. So.
Well, I think we owe some thanks to the citizens group that took on kind of the information/campaign. I know there were several individuals that helped fund that, and also to the chamber who organized the mailing. I think we had about 12 volunteers that helped stuff envelopes. So, we could provide the information, but the push to vote yes was from citizens that stepped up, and just want to say thank you.
I think it's important to note we should all have a sigh of relief because we don't have to have an election every 4th and 5th year. But that doesn't mean the accountability will go away. Now that we don't have to have another election for 10 years, I think it's important to note that the group that Matt heads that put together the information on the website, that will be continuously updated. It's a very transparent program. I think you can see that in the vote that was cast. People understand what the roads are and the importance of them and where the money's spent. So I think all in all, it's a program we can all be proud of. And but we need to make sure that people understand that we're not going to take it for granted that, okay, we've got this for 10 years and we'll see you in a decade. That's not the case. This is a critical part of all of our efforts to grow the town and make it a great place to live. And Matt and his group have set up an unbelievable program to help people see that for themselves online whenever they want to.
All right, I would entertain a motion to approve.
I have one question.
Oh, I'm sorry.
We've had a couple of discussions on this, as I recall. This is maintenance and repair only. This is not new construction, correct?
Correct.
Okay, that's.
Well, now that you bring that up, Larry, we do use some of that road, street sales tax in developments, offsetting the cost of concrete over asphalt. So that's new roads. So
we've done that twice.
Then should we have that in there? Because
I've
we've had some
before.
discussion that wasn't liked very much by using that money.
I've asked for that before. I'd like to see that in, but that didn't happen. But for whatever reason, but yeah, like you said, the ordinance says it says maintenance and repair of existing streets. But we do use the money in new developments.
Well, I like the concrete over asphalt. I mean, it's a no-brainer, but we should make it simple enough to say it can be used for that.
Well, I think
Pending approval of something.
You can't change it now.
You can't change it now. They voted on.
Well, we don't need to get in more discussions that over that situation then. We need to avoid that.
It doesn't say existing streets, it says city
No, it says
streets.
maintenance and repair of city streets.
Right, so it depends.
So it's clear.
Yes. So it's
So I understand what you're saying, Larry, and I understand.
Well, I'll vote in favor of it, that's not,
Yes, exactly.
but I don't like the idea that we get sideways over this thing. Because if we use concrete over asphalt, it is to the benefit of the city and the benefit of the city taxpayer.
Well, first of all, we have not taken money out of street sales tax to improve those roads. We took it out of EDAC. So we had a big discussion.
Yeah, we had the big discussion that the money came out of here, though.
No, it came out of the general fund and it came out of the revolving loan fund.
But the allegation was it came out of here.
The original recommendation was it did, and after discussion, it did not.
Did not,
and has
okay.
not. So.
And anything that does happen will come before this group, so you can address it at that point, I guess.
Okay.
But I don't think you can change the ordinance language that passed at the election last week.
Okay, so.
If that clears it up, I move to approve.
I'll second.
Moved by Patrick, seconded by Larry. All those in favor say aye.
Aye.
Opposed, same sign. Motion carries. Thank you. Non-agenda reports and requests. Darren, anything from the city?
Jay had something he was gonna follow up on.
Well, the city was working with USD 250 on a program to try to bring some broadband to some families that needed it. And we were approved for some funding for that. It was enough for basically, it was about $250,000 for a pilot program. The city's going to install and help install and maintain the infrastructure. We're working with Motorola on this. It's using a newly available spectrum from the FCC called the Citizens Broadband Radio Service. It creates a private cell network, all right, that we can deliver internet to families for, and we think it's going to be successful. It's a new thing, and we're going to prove it with this pilot. It has to be done by the end of the year, so we're already mobilizing with Motorola. So we're going to see how that works. But if it works, we just had a call with the Department of Commerce. They're going to do a rollout so we can hopefully do all of the students that need it throughout the entire USD 250 service area. So it's kind of exciting.
How many students is it going to service?
The pilot will serve about 100, and there'll be considerably more than that for the rest of the city.
So do you think we're the first in the state to use this approach?
Oh, we're definitely the first in the state. We're one of the first in the country to do this.
Okay.
It's kind of exciting.
Yeah.
But Motorola we feel a lot more comfortable working with Motorola, that's for sure. But anyway, it's coming up, so you'll hear some stuff about that.
Great.
Thanks, Jay. That's all I have.
Anybody else? Okay, entertain a motion to adjourn.
So move.
I'll second. Moved by Patrick, seconded by Donna. All those in favor say aye.
Aye.
Motion, yeah, I think everyone's.